Food quality. Of course, the quality of your food is also important. If your goal is to really optimize your weight loss, you'll need to be eating healthy foods most of the time. This means participating in grocery shopping and cooking if you don't already do so. It'll also be important to bring your lunch to work most of the time, to be mindful of how often you eat out at restaurants, and to watch what you're snacking on. It's important to understand that not all foods are the same. For example, eating a fresh apple isn't the same as eating an apple pie, or eating oatmeal is not the same thing as having oatmeal cookies. If you don't understand the differences between these foods, it's strongly recommended that you meet with a registered dietitian to have a discussion on the quality of your food. Limiting sweet foods is going to be especially important if you're planning to have the Roux-en-Y gastric bypass or mini gastric bypass. Have you heard of dumping syndrome? Patients who undergo these surgeries are at risk of experiencing dumping syndrome if they eat too much sugar in a sitting. Dumping syndrome is a reaction that happens typically with the gastric bypass that will make you feel unwell. You'll feel nauseated, sweaty, shaky, and you'll likely will experience some diarrhea. To give you an example, you'll be fine if you take 2 to 3 bites of cake, but you'll likely react if you have a whole slice of cake all to yourself. Or, as another example, you should be able to have a half cup of juice, but you'll likely react if you have a full cup of juice. In some ways, this is your body's alarm system warning you to cut back on sweets. To prevent dumping syndrome, you'll need to limit the amount and how often you eat sweets like cookies, cakes, pastries, chocolate, maple syrup, honey, and sweetened beverages such as juice, soda, and very sweet coffees. You'll learn more about dumping syndrome in the material that we've prepared for you after surgery.